They were all here, and so that's all on me. I'd like to recognize Ahmed Velez, who's the Regional Director of CVS Health, and he's, where's he at? Okay, yeah, so he's going to say a few words, and then, look, we got the murderer's row here with elected officials. I mean, we have Senator Diaz, Ana Maria Rodriguez is here. We have Representatives Perez, Fabricio, Alex Rizzo, Representative Cabrera, Pepe Diaz, Lieutenant Governor Nunez, County Mayor. I mean, did I miss anybody? Wow, so that's good. Well, it's good. It's fitting because I think today is a really exciting announcement. So I'm here, very excited to be able to announce that starting tomorrow, seniors age 65 and older in Miami-Dade County will be able to schedule an appointment to get vaccinated at every single one of the 31 Navarro discount pharmacies in Miami-Dade County and every single one of the 35 CVS EMA stores in Miami-Dade County. 15 traditional CVS stores will also be offering the vaccine in numerous other counties. There is going to be one of those in Dade throughout the state, and basically they were selected to help ensure vaccines reach underserved areas. One will be in Dade, as I mentioned, 2 in Broward, 1 in Palm Beach, 1 in Collier, 1 in Hillsborough, 1 in Manatee, 1 in Hendry, 2 in Polk, 1 in St. Lucie, 1 in Volusia, 1 in Flagler, 1 in Gadsden, and 1 in Escambia. So once appointments are made, vaccinations will begin later this week. They think Thursday. The vaccine's supposed to arrive today, but once you go on tomorrow, you'll be able to select and make an appointment. So to make an appointment at a Navarro discount pharmacy, CVS EMAS, or traditional CVS pharmacy, please visit cvs.com. There's a prominent display at the top of the website. When you put in your zip code, you will be directed to the best options locally. Each site will perform over 100 shots a day is what they're shooting for. Can you do that? Okay. Well, that's going to be really, really good. And if they get more supply, of course, they may even be able to scale up. But this is going to be really significant, I think, for this area. This is the first place we did a big drive-through site at Hard Rock. You have a great health system that's done great. Jackson getting shots out, and there's been other things that have been done. But this really provides a strong retail pharmacy footprint for Miami-Dade County. And I can tell you the retail pharmacies have been a key component of getting shots in the arms of seniors. So if you look throughout the state of Florida, we've been focusing obviously on seniors first. We are #1 in the nation, or close to #1 in almost every key metric involving seniors. We vaccinated well over 2 million seniors. More than 75% of every dose that's been administered in Florida has gone to a senior citizen, and we are going to hopefully hit very soon 50% of all seniors in Florida will have received a shot. We're in the we're about 45-46% right now. If you look at South Florida, Dade, we have 42% of seniors have gotten one shot. This pharmacy is going to be able to bring those numbers up, I think, very quickly. And I would compare Dade to Palm Beach. Palm Beach has a very elderly population. 57% of those seniors, though, have received a shot. And I think the difference was when Publix expanded into Palm Beach County, it was similar to what we're going to have in Miami very soon. They had over 60 stores. And so people were going into the pharmacies and getting shots. And so I think this is really, really significant in increasing those numbers in Dade very quickly. We're also proud Broward is now 52% of seniors in Broward have received a shot, and we're going to keep on going. Now, this is going to be the most significant footprint for CVS-affiliated pharmacies in the state. As I mentioned, we do have close to 600 Publix pharmacies. And then we also now have almost 120 Walmart and Sam's Clubs throughout the state of Florida. And we have 42 Winn-Dixie. So that's 52 different counties in the state of Florida where you have an ability to do a retail pharmacy. So to schedule an appointment at a Publix pharmacy, visit publix.com/COVID vaccine. For Sam's Club, samsclub.com/COVID. Walmart is walmart.com/COVID vaccine. And for Winn-Dixie, it's winn-dixie.com/pharmacy/COVID/vaccine or -vaccine. So we think that the retail pharmacy access, these are in people's communities. In Palm Beach, when we were decided, I went and met with the county mayor and the government there. I said, what would make sense to up these numbers? This is like over a month and a half ago. And they said in Palm Beach, 90% of the seniors live within a mile and a half of a Publix. And so we were able to do it, and the numbers speak for themselves. And I think this is going to serve a similar function here in Miami-Dade County. Now, if you look, the retail is obviously one part of our strategy, but we've done a whole bunch of other things, and we're going to continue to do on all these fronts. We have done a number of vaccine events at places of worship. We've had 65 different faith-based events across 18 counties, and that's close to 50,000 vaccinations at this point. In Dade, we've done a bunch of them, including the First Baptist of Homestead, Greater St. Paul AME, the Haitian Emmanuel Baptist Church, and San Lazaro Church. In Broward, we've done First Baptist Church of Piney Grove. We've done Hopeville Missionary Baptist Church, and we've done Mount Hermon AME. And so we're going to continue doing that. As people have some of these congregations make requests, we work to be able to fill them as best we can. Of course, we were just here in Aventura at the synagogue, and we had people from a mosque, a church, and a synagogue, seniors getting vaccinated. And so we think that that's really good. We also continue to send a lot of doses to the individual counties. There's 87 permanent community vaccination sites across the state of Florida, and those are most of those are doing really well. When some of them aren't doing as well, then we try to go in and supplement. We've also been able to do events at senior dominated communities. We've done over 15 senior communities across the state, and that's been about 75,000 shots in those communities. In Broward, which is where we've done the most by far, there have been 32,000 doses administered just for some of these senior communities. So we've done the Century Village in Deerfield, as well as the Century Village in Pembroke Pines. We've done Kings Point and Tamarack, and then we've done Winmore Coconut Creek. So those are thousands and thousands of seniors. You go in, you're able to get it done in a very efficient way. Also in Palm Beach, over 20,000 doses. We've done Century Village in Boca, as well as West Palm Beach, and then Kings Point and Delray. That was the first senior event that we did when we started doing the seniors first. We've also done things at Sola Vida, Lakewood Ranch, Sun City Center, and then most recently at the Mainlands in Pinellas Park in Pinellas County, Florida. So we're going to continue to find senior-dominated areas to supplement the ongoing vaccination efforts. And we're now up to, with our Homebound Seniors program, we're now over 1,300 seniors. And so we started with the Holocaust survivors. We've also done Bay of Pigs veterans. We were here locally within the past couple weeks. And then we're really working hard on our World War II and Korean War veterans. And so we think that that's really good. Of course, the hospitals are still playing a critical role. They do tens of thousands of vaccinations statewide. We are very happy that we're going to have some federally supported sites, including one in Miami-Dade County. It's going to have one in Hillsborough, Orange, and Duval, and this is coming in with federal resources. We have to basically manage it at the state level, but they're going to put in additional doses above and beyond the state's allotment, and these are tens of thousands of doses in a given week, and so we're excited about that. And because we have these extra doses, of course, we're going to continue to make all those sites available for our seniors, but the federally supported sites, if as long as it works out to where the doses will be allowed for this, we want that to be open not just to seniors, but to sworn law enforcement and classroom teachers. And so we'll start probably 50 and up for the police and the classroom teachers. The fire, who hasn't gotten it, some of the fire have already gotten it, will do it. We've also polled all the police and sheriff's departments, and they're getting us information about how many folks do they have that are sworn law enforcement officers, what about 50 plus, and then of that, how many want it. And our goal is to be able to get that as more vaccine becomes available. And I think we're going to have the ability to do that between these federally supported sites and some of the new vaccine that may be coming online very, very soon. So then, of course, if you look at the hospital census continues to go down. There was a lot of people who were complaining about the Super Bowl in Tampa. You look at the numbers in that part of the state, it's continued to go down. We're very happy. I think at this point, if we continue to see it go down and you don't see any increases, that may be the vaccine starting to play a role. I don't think up to this point, it's been going down now for over a month. I don't know that it was the vaccines at first. It was probably the natural cycle, but I do think we are starting to see when you have, we're going to have, I mean, we're reporting about 2.1 million seniors, but we know that these are far behind. These are 4 or 5 days behind the reporting. So we're probably getting close to almost 2.5 million seniors that have had a shot. And we also know these first shots seem to be pretty effective as well. So I think you're going to continue to see some positive trends because of these vaccines. And that's the name of the game. You know, we're trying to get the vaccine to the people who it will make the most impact for. You know, that's our senior citizens. And I tell you, I got a note from a couple in Mainlands in Pinellas Park. We did one of the senior events there. And you know, they have all this great stuff within this community, clubhouses, all this stuff. And they haven't used it since March. And so this was, all these seniors were in line there. We did thousands of them over a few days. And they wrote to me saying, you know what, we want to get our clubhouses open again. We want to be able to go out and live life to the fullest again. And I believe that that this vaccine will be the ticket to that for many of our seniors. Of course, many of them have been living and making choices all along, you know, but for others who really haven't been comfortable doing things, this provides it. And so CVS, Navarro, part of the mission, we thank you for stepping up to the plate, and we think that this is going to make a huge impact on seniors in Miami-Dade County. Come on. Yep.
Thank you all for being here. Thank you, Governor. My name is Ahmed Velez. I am Region Director here in Florida, and so pleased to be able to join with the Governor, with so many representatives of state government here. These are great news. These are new developments to the state's response to COVID-19, and I'm very proud to be representing it. I'm also very pleased to represent the thousands of CVS colleagues throughout the state who share in the governor's commitment to delivering solutions that ensure the health of the communities that we serve. To put the pandemic behind us, this pandemic has taken a lot of lives, and we want to fight. None is more pressing than protecting Floridians against COVID-19 through a timely vaccination process. As one of the state's pharmacy partners for administering COVID-19 vaccines, CVS Health is ready to continue our role in coordinated response to the virus, and it is our responsibility and mission to make sure vaccinations get distributed to those who need it most, to those who are most vulnerable. One of our greatest strengths as a company is our presence in the communities. And I would say that the required second dose is so extremely important, but the initial one is also the one that we have to get done pat right now. At CVS.com or the CVS app, or even a CVS customer telephone number, which would be 1-800-SHOP-CVS, could grant you that possibility for that first shot at any CVS, at any one of our 81 CVS EMAs or Navarros in the state of Florida. Individuals will be able to schedule these vaccinations, and we want to make sure we make it easy, even for those that don't have technology or don't have access to an iPhone. Dozens of these retail locations that I just called out are familiar, culturally relevant healthcare destinations for Black and Hispanic populations across South Florida and other communities with the greatest need for support. We recognize the challenges in vaccination. Medically underserved populations are right now being impacted. Thank you, Governor DeSantis, for your help. Thank you for joining us and for our partnership for, I would say, the greatest public health challenge of our time. And our commitment to all of you here and to our governor is that we will do all that's in our power to vaccinate all who need to get vaccinated and fight this terrible virus that has impacted our communities. So thank you so much for all you do, and you can count on CVS being in the forefront of this terrible virus that's impacted 500,000 people in this world. Thank you so much for all you do.
Yep. Well, thanks. I'm really excited about this. I think this is going to be great. And as you said, this is a place people are comfortable coming. And not everyone wants to drive across town to go to sit in line for a drive-through or even go to a hospital. This is something that people go to in their daily lives. So we're really excited. You're going to see once these guys get these shots going. I mean, you're going to see those numbers go up very quickly because they have these spread out all over. I mean, they're going to do 100. Even if they were doing 25 in each store, you would see that because of how many stores there are. And I look forward to seeing that. We also, one of the things we monitor on a daily basis is what percentage of seniors in each county has received at least one shot. And Miami is kind of close to the state average. They're going to go above the state average because of this, which is great. Obviously, Broward, Palm Beach, above the state average. We have some counties. We had Charlotte, Manatee, and Sarasota that were lagging. We surged some more resources there. They're starting to do better. We have Hernando. We're going to look at Hernando. They're still not where they need to be, and they've had retail for a long time there, so we want to send more. We also have a lot of these rural counties. Some rural counties have done really, really well. You look at a place like Gadsden County, they're above the state average. You look at Wakulla, some of those. But then we have some like DeSoto and Hardy and Glades that are lagging. So we are going to be rolling out a rural vaccination program, and it's basically going to be targeted at the areas that have a low percentage of seniors. A couple of those counties, I think, are even under 30% for seniors that have received a shot. So the good thing about the rural areas is that if you do surge it, you can see the numbers go up pretty quickly. We did that in Pahokee, up in Palm Beach County a couple weeks ago. Have had good results there, so we're going to continue to keep an eye on that. But that's at the end of the day what we're looking for. Anywhere where there are seniors and you don't have a big percentage of them, let's get those percentages up. Miami has done. The bigger the area is, the more people, the more challenging it is. That's just the bottom line. And so Miami is that you've had some great work here for people working really hard, and I think this is just going to supplement that and really take it to the next level. So we're excited about this. We're excited about the federal supported sites, one of which is going to be in Miami. We're also very excited that seniors first, of course, but we're also going to be able to offer for law enforcement, fire, classroom teachers with those federally supported sites coming online. So I think there's a lot to be thankful for, a lot to be excited about, and we're going to keep on working hard all the way through. Questions?
Question on the retail pharmacy program. Sam's Club, Walmart, Frisco, and Moss, after you did the initial rollout, they've yet to offer additional vaccines, in part because of the shipment that was delayed. Where are we on that? They haven't said when they're going to start doing it. 3 times.
Yep. So they should have all received last week's Moderna shipment by Monday, this past Monday. So as you guys know, we're lucky in Florida because it was like it didn't affect us directly, but the weather was horrible. So you had Moderna vaccine just buried under snow in these warehouses. They usually come Monday through Wednesday. Well, last week got delayed to Friday, then the weekend. So some of it came Sunday, some of it came Monday, but I think their issue was they didn't want to make a bunch of appointments not knowing whether they'd have the vaccine there. So I think the minute that all of them have the vaccine and they know that they can offer, then they're going to offer it. But it's an unfortunate situation. The Pfizer came in. I think we were short a few thousand Pfizer, but the Pfizer came in, which was good. But it was the Moderna, because of where it was shipped from, that got. Now, that's the bad news. The good news is we basically have twice the Moderna that we're going to be able to do this week. And so all those areas, I think, are going to fill up their appointments. And the good thing about the CVS thing is these are doses over and above the state's allotment. This is part of the federal pharmacy program. Now, Publix is part of that, but we also do some of the state allotment because they were the first retailer that was ready to go, and we wanted to get a start on that because we viewed this as really the easiest way to do it. So they're going to be getting these doses are going straight to them. And so if we're getting 350, 400,000 as the state, that doesn't even count what they're getting. So that's really, really good. So if you had an appointment and it got canceled, just know it was beyond the control of any of these pharmacies. They couldn't get the vaccine in because of the extreme weather. Yes, sir.
We're talking about senior communities, and as you know, there's a former governor who made a claim it's politically motivated. Tell us again, though, when you choose those communities and how you allot the doses to those communities, because the Sun Sentinel released a list of doses for this week, and I didn't see a line on there for you to travel the state, go to these various communities. Has that changed?
So, well, a couple of things I'd say. I mean, you're right. There is a political motivation. I'm not sure the calculation. I mean, I don't think it's an effective political tack to attack me for vaccinating seniors. Yes, we are aggressively vaccinating seniors. And I don't care who you vote for, any of that. And I think the proof in the pudding on that is that Broward has had the most of these senior community visits of any other place in the state. And that was something because we knew we could get a lot of these done very early on. So we're proud of vaccinating seniors. We're going to keep doing it. I can tell you, the seniors, when we visit these communities and are able to do it, man, they are so, so thankful. Some of the correspondence I get, it's just so very, very heartfelt. And again, this isn't taking away anything that is going to any of these counties. This is additional ways where you can go in and over a matter of days, knock out potentially an entire community of seniors and get thousands and thousands of doses. I mean, some of these Century Village, they were doing 4,000 doses in over the course of a few days. So that's really, really important, and it's going to be an important part of our effort. Now, we've done 4 million shots, and about 75,000 have gone to the senior 55 and up program, just as the churches have a certain number of it. So I think all those are effective, and we're going to keep doing all of them.
Those doses would have gone somewhere else, right? Those
But-
doses would have been available to go somewhere else had you not traveled to state with those pop-ups.
Right. So like if I have 3,000, I could potentially give 10 to this county, then to that. But the question is, if a county, particularly now when you have counties that are behind, you can go in, knock that out. That increases the numbers, and then it takes pressure off the existing. So if you have Publix pharmacies in a place like Sarasota, well, those are 3,000 seniors who are not now going to need to be participating in the Publix pool, or will participate in a county site or the hospitals or things like that. So it's totally supplementary. It's obviously good for those seniors in those communities, but it's also a way, I think, to relieve some of the backlog and some of the pressure on some of the other ways. So we think it's been very effective. We'll continue to do it. Yes, sir.
Can you go into more detail about when teachers and police and fire will get the vaccine, where that's going to come from?
So when these federal sites, so we're going to get a federally supported site in Miami-Dade. We think it's going to happen next week. We want that for 65 and up, but we also want that to be open. Any sworn law enforcement teacher, I think, will start age 50 or above. We also, as we get into approval for the Johnson & Johnson vaccine, and as Pfizer increases its production, we still have seniors to do. That's still the priority, but we can take some and really knock out a lot of, I think, these folks potentially pretty quickly. So we're going to start for sure on these federally supported sites. As new vaccine comes online, then we'll see what happens. Yes, sir.
Governor, you've said on many occasions that you won't let any local government kick anybody out of their jobs or shut a business down. Yet here in Miami-Dade County, I'm a talk show host, and I hear from business owners and workers all the time saying because Miami-Dade still has a curfew, they're getting kicked out of their jobs, not able to make a living anytime after midnight. Why is that still being allowed to happen when you say you won't let it happen?
Well, one, I'm not saying I agree with curfews. I don't. I've never supported a curfew. But at the same time, what I had to do was prevent anybody from closing a business or shutting an individual down. And that was the right decision. If you look at what's happening in South Florida right now, I mean, this place is booming. It would not be booming if it was shut down. Los Angeles isn't booming. New York City's not booming. It's booming here because you can live like a human being. People take precautions, which is great, but you're not locked down. People aren't miserable, and I think it's really remarkable what's happening. What I think the legislature should do is look about just moving on from some of this emergency. Now, I have no emergency rules on anybody. The only emergency I use is to get the reimbursement from FEMA. If I don't have that, then all the stuff we do, we don't get reimbursement to the state, which obviously we want from a perspective of just fiscally recouping any losses that we're doing. But that's the only, I think, valid reason to have any of that in place at this time. I know Manny and some of these guys in the legislature are going to look at local government pandemic powers. And I mean, if you think about it, even when COVID started to emerge in January, and we were very much engaged in that, some people were saying, oh, no, that it wasn't a big deal. We thought it was potentially very serious. But I don't think anyone at that time thought that there would just be these forever restrictions. That's really not the way anything has ever worked in the past before. And I think that if a local government's going to do it, I do think absolutely there needs to be a limited duration, and it should require some type of legislative sanction. And as a governor, the legislature can come in and they actually can terminate anything that the governor does, and I think that's absolutely appropriate. That should be the case. Now, they haven't done that with me because we were very judicious in what we were doing, and we were really using our authority to lift people up rather than to lock people down. But I think it's a legitimate issue. My order did not necessarily cover that. But people do have a right to earn a living. We want to make sure that's done. So stay tuned in terms of the legislature. All right, guys, great seeing you. We're going to take off.
Governor, the Mayor of Hialeah, how are you, sir? We would like to speak. First of all, I'm very grateful to CBS and Navarro that they did this. But first of all, I was not invited to this, just like I was not invited to a previous meeting, even though Hialeah is one of the cities most affected by COVID. They talked about no politics. You saw it here in plain picture. But the important thing is, and what I wanted to let the governor know, is that the local governments are ready to work to help CBS and these places distribute these vaccinations. But again, I don't know why he doesn't want to talk to me or invite